very good morning and Happy New Year. So we are from the Department of Parasitology. Glad to kickstart the breakfast at UMHealth for the year 2025. So today we have Prof. Hesham to speak on the global burden of disease from data to policy. Let me briefly introduce Prof. Hesham to you. So Prof. Hesham has a PhD in public health and master's degree in medical science parasitology and also in applied statistics. So he has been actively engaged in research on molecular epidemiology and prevention of infectious diseases. He joined the Department of Parasitology for 7 years as a senior lecturer and promoted to associate professor. Then he joined to Jazan University, Saudi Arabia, and was promoted to full professor. And his love for University Malaya made him rejoin University Malaya in 2023. He has taught several courses in parasitology, epidemiology, biostatistics at undergraduate and postgraduate levels. His research is dedicated to helping vulnerable rural and aboriginal communities in Malaysia and other countries. He has published more than 150 articles in high-impact ISI and Scopus Index journal with H-index of 41. Prof. Hesham has been a member of several academic, scientific, and administrative councils and committees. He has also enjoys reviewing scientific manuscripts, research proposals, plans, and strategies, theses, and reports. He is a member of editorial board of several renowned journals and a regular reviewer for many peer-reviewed journals, as well as panel member of assessors for various national and international research grant schemes and postgraduate programs. So without further ado, let's welcome Prof. Hesham. Prof. Hesham, the screen is yours. You may share your screen, Prof.
Okay, thank you very much, Dr. Aaron, for the nice introduction about myself. And good morning, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. I'll talk today about the global burden of disease, which is a unique platform for generating evidence from big data, guiding policy for meaningful change, and ultimate goal of saving lives. What is the global burden of disease? It is the largest and most comprehensive effort to quantify health loss from hundreds of diseases, injuries, and risk factors across locations, sexes, age groups, regions, and also over time. The latest global burden of disease study published in just in May last year, it called or labeled with 2021. That one published is considered the most comprehensive global health study, analyzing about 288 cause of death and 371 diseases and injuries, and 88 risk factors. So as they prefer to describe themselves, and I also agree on this description, the GBD is the most accurate and up-to-date estimates on the disease burden worldwide. This is a history about the evolution of the GBD, which started in early 1990 by the WHO and the World Bank, and they, with few researchers from the Geneva and also from Harvard University, they work on the data produced by published study. It's the same story like the meta-analysis, systematic review, Cochrane reviews. Is the same. They start with the same concepts. After that, they publish the first burden or the first GBD study or results in 1996 by the WHO, and another publication on 2004, and then updated every year until 2007. There was the establishment of the Institute of Health Metric and Evaluation at the Washington University or University of Washington in USA. And then since that time, the IHME take the initiative to produce the GBD and to make it or to develop it and improve as the most comprehensive study. And they published the first reports or the first results in 2010. And then after that, since starting from 2016, they publish every year annual GBD results, which has interrupted in 2019 by the COVID-19 pandemic. So this is why the only 2021 just published last year on May 2024. Okay, because they need to spend time to accommodate the changes occurred due to the COVID-19 on the health and on everything, on all aspects of our life. So they delay publishing the results of 2021. So the first one published in 1996 by the WHO cover only 107 diseases, 10 risk factors only, and cover 8 regions, usually the WHO regions. And they have done projection of data to the 2020, while the latest one, the recent one, covered 371 diseases, 88 risk factors, and covers 204 countries and territories, and the projection improved or extended to 2050. And from few or dozens of researchers in 1996, just few researchers, to more than 12,000 collaborators today or currently contribute to the production and of the results and publications. So the main results of the global burden study disease published in the Lancet in annual special issue, starting from 2010, and then from 2015, every year they have 2015, 16, 17, 19, and then 2021 just last year. The latest one, or the most recent one, published on May 2024, covers, again, I already mentioned these numbers. So it involves over 12,000 collaborators contribute to the verification, the development, the review of the results and the publications. Usually they publish between 5 to 7 articles in this special issue every year. These are the main results of the global burden of disease. Subsequently, hundreds of publications nowadays published every year from this source of data. Many people, they just take the advantage of these publications and the huge amount of data, and also the open source of data to publish articles in high impact journals. If you are interested, or those who are interested in publishing and using the open source of the IHME, I will show you at the end of the talk how to access and how to use the data for publication. Other than Lancet journal, the main Lancet journal, other GBD publications, as I mentioned, 100 of the publications, they published in the other Lancet journals. For example, the Lancet HIV, Lancet Infectious Disease, Lancet Planetary Health, Lancet Global Health, Lancet Public Health, all Lancet journals. And also some of the high quality results published in top journals, top prestigious journals like Nature, Nature Medicine, JAMA Oncology, and so on, every year. This is the overall publication statistics by the IHME resulted from the global burden of disease only, because they have different projects. The main one is the GBD. So until now, over 3,700 GBD papers published in peer-reviewed journals in 2010. And you can see here, these articles received very high, huge citations because of the high quality of the data and the results. And another interesting point here to talk about is, you can see here, for each column, the dark color represent the publications or the papers published by non-GBD members. No need to be a member or official collaborator for the GBD in order to be able to publish their results. No, most of the articles are published out of the network. So the policy impact of the GBD, indeed, the GBD provides the opportunity for decision makers, for researchers, for even informed citizens to read the multiple infographics, to access the data tools, and to compare their countries with other countries based on the time, age, gender. Sometimes within the country itself, some countries now, they have the subnational level of data that cover this subnational level. So overall, this GBD represents a roadmap for health policy makers. For example, here, just selected examples, many countries now, they use the GBD results to improve and to develop their health policies. For example, Chile, this one in Ghana, in Indonesia even last year, end of 2024, they have developed the new policy now, the new 5 years policy based on the new GBD 2021. Also here in Pakistan, even in the developed countries, Norway, France, New Zealand, UK, and Brazil, Iran, India, all these are the policy books that developed in collaboration with the IHME based on the GBD results, and some they describe here. For example, this in Singapore, the burden of disease in Singapore 1990 to 2017, and they have the new one already. So in Malaysia also, the policymakers are aware about the importance of the GBD data, and they have created publications or reports based on this. It is clearly written inside the acknowledgement and the preface of these reports. The main source of the data are the IHME, which is the GBD. And they have, every 5 years, they create, by the National Institute of Health, Ministry of Health, they create one report, and then this to guide the policy. Who works on the GBD study? Actually, the GBD study is a project led by the institute, as I mentioned, the IHME from the University of Washington. And also currently there are more than 12,000 collaborators from over 163 countries. And this is a simple organization chart, which is a very simple, just they have a scientific council for the GBD, and then a management team who start collecting information and the suggested titles and the sources of the data, and then a core analytical team, and then a robust network. They consult and they ask all collaborators to contribute by providing sources, evaluate or optimize the sources, or critically review the articles or the manuscripts before sent to the journals, and many other contributions from collaborators. This can see the improvement of the global network of the international collaboration. In 1996, they have only two small groups, one in Geneva and the other one in USA. But in 2010 becomes larger, while now it's already covered all over the world, 163 countries. And some countries here, this map show the network. Some countries, they have more than 200 collaborators representing this country. For example, India, Ethiopia, Pakistan. And some countries still without representatives. And some, for example, like Malaysia, they have between 20 to 60 collaborators from different institutions and different agencies. So before the GBD, what is the importance of the GBD? Before the GBD, or until the late of 1980s, there is no coherent estimates of disease, injuries, and risk factors. We have only the total number of mortality and the prevalence incidence of some important diseases. And the sum of, when people sum the cause-specific deaths, for example, death because of malaria, because of dengue, because of HIV, because of cardiovascular diseases, unfortunately, the sum, they found always that the sum was greater than the total number of deaths, which reflects inaccuracy of the data. So after the GBD, after 1990, now we have a comprehensive burden measurements of health, able for comparability and also completeness. The burden measurements of health, these are the metrics developed and used by the GBD. They developed the most important one, what we call the daily, is the disability adjusted life years, which is the number of years lost to illness, disability, or early death. So it is here, it is a formula. I don't want to bother you with the formula and the calculation, but these are the most, because we have a very limited time, these are the most important metrics they use for the GBD. So they have what they call GBD data visualization tool. Everyone can access and can use, and I will show you how to use if you are interested, or the other policy makers, researchers, lecturers, they want to use data and very nice, accurate graphs. They want to use for presentation, like what I have after this. They want to use for teaching. They want to use for publication. All are available for you for free. This is the, for example, comparability of the data sources. Some countries, they have a plenty or a huge number of data sources, while some, they have just small numbers. How they adjust this is related to the methodology of the GBD. Is a sophisticated methodology in order to create data for those, even some countries or some territories, they have no data sources, but they are able by the modeling to create data based on different methodologies. So these are examples for the results or the figures you can produce by yourself. And this already published in Lancet, for example, this one that you can see here. This is the leading cause of death. Comparison between at the global level, comparison in 1990, and then in 2010, and then 2021. And there is changes. This can reflect or can show the changes over time by the ranking of the most cause of death over time. This one is here according to the non-communicable disease, communicable disease, injuries, about the level of risk, the level of causes or risk factors. And again, across the time, 1990, 2010, and 2019. So the methods or these results are based on 100, not what we call a huge number of resources, thousands of resources. For example, here it's available also. You can access and have a look on the resources. This one, if you, the website is the IHME data or IHME. If you access Google IHME, then you will have access to the data where you can access the source, either global or you can, for example, select Malaysia. Here you can select for Malaysia, is covered by the stop sharing here, okay? So you can select Malaysia or any other countries or regions. Okay, the methods or the GBD is produced based on the set specific geographies. They have 7 GBD super regions and 21 GBD regions presented in this map, and also they have, or they present their data and results according to 8 age groups, the 3 groups of sexes, the male, female, and both sexes combined, and then the locations at the global, regional, national, subnational, for the location, and also years. They have 19, they consider this series, 1990, 2000, 2010, 19, and because of the COVID here, they consider 2019 and also after COVID to evaluate the impact of COVID on the health metrics. These are the classification or the hierarchy of the cause of death. They have 5 levels of cause of death. So you can access the IHME websites and read about the methodology if you are interested. The most important here is today is to show you how to use the data for publication. This is the data visualization tool that I will show you later. This how to create, this is the tool itself. So you can choose the cause of death, and location, for example, is Malaysia or global or any other countries. About 204 countries are available. And then you select the year. For example, here I choose 2021. You have from 1990. And then age, I consider all. And for both sexes, this is the what we call the matrix for the cause of death. And then you can download a very nice and high resolution figure. This is the figure one. This is the download one. You can download and then a high resolution for that can be used for publication, for teaching or presentation. You can also compare between according to the time, 2010 and 2021. What is the changes in the cause of here, causes of daily, for example. It can be causes of death. It can be risk factors. Many things you can use this visualization tool or compare data for many things. This is I use for Malaysia to compare between from 1990 until this 2021. And you can see the changes in the ischemic heart disease is always number 1, and then changes due to COVID and other parameters or other health conditions. Here, male and female, you can compare according to gender. And from we have from UM's collaborator in the GBD, so we publish with them the main results in Lancet and many other articles. So I try to access and find the UM's collaborator. I found beside myself is Prof. Hani Arifin from the Department of Pediatrics, and Associate Professor Dr. Lemli Ling from the Department of Medicine, and the 4th one is Dr. Siddharthan Silvaraj from the Faculty of Dentistry. There might be other collaborators, but I could only find these 4. So the country profiles in the GBD can also be accessed. You have ready data and ready diagrams, ready graphs for to be used for presentation, but they are not nice for publication as the one produced by the website, by the tool itself. So I finish my talk, so I will take 5 minutes to introduce the GBD data visualization tool and how to use the tool. Okay, you access Google, you access the Google, and you just search for IHME. Okay, IHME visualization tool, or just the IHME. So it is the first one here. You can hear data tool. It's easy, or you search, you can find this interactive data visuals. So this is the one, the tool called GBD Compare. From here, anyone can access, no need to be an official member or collaborator. From here, for example, you can use here. For example, here you can, it is very easy also to use this visualization tool. For example, here you compare by year, and then you select the death, causes of death for global, let us say global. So here is you have two maps or two matrix. If we say maps, I choose the map. You will have the map on the above is for 2021, and this one is the same. Actually, is the same because I still need to change here. For example, the top one is for, I want for 2010. I just move here and select 2010. So, and the below one is for 2021. Both the top both are for both sexes. I can choose, for example, the top for male, or I just compare the male. I can choose the top for male, the lower for female, and many comparisons. And then I can also causes for daily is a different story. I can use the map or use this matrix to show how changes over time from 1990 to 2021. And also here, I can change the level of risk factors to the third level. I can change the country from global. I choose, for example, Malaysia, and then here. This is Malaysia. Okay, I can compare, for example, between the Western Pacific region. I can compare between Malaysia and Singapore, or Malaysia, Singapore, Indonesia. Whatever I select, I can do here. And then from here, for example, this figure now, it is publishable. It is publishable in Lancet or any other journals. You just go to download. If you click download here, you can click the screenshot, will give you the only the figure with high resolution, or you can get the data, the raw data in CSV, or sometimes in Excel. Okay, this one here, you can choose the matrix also. This matrix, you can choose single for only one country. No need to compare, no need to have two above and low and below maps. So this one, for example, is the cause of daily for Malaysia. So ischemic heart disease is the main one, and then followed by stroke or COVID, and then stroke, and so on. So please access this, what we call data tool, and try to, according to your interests, the field of research, from 371 disease and injury and 88 risk factors, you can select one, for example, that there is no publication yet for 2021 or the old one, and there are many still raw data. Okay, and then the method you can just take from the they have a text for method. It's ready. You will just describe what they have done, and the results already here. The text, the tables, and the figures, it can be created by this tool. And then you just need to write the introduction and discussion and send for Lancet Journal. And I wish you all the best. That's all from my side. And if you have questions, you are welcome, and sorry to go fast. The time is very limited.
Thank you, Prof. Hesham. I think you have covered pretty much a lot in this time allocated. So we have a couple of questions for you to maybe you would like to quickly answer. There's one question from Sarah Ahmad. She has asked, does it cover congenital diseases too?
Yes, congenital diseases and too many things, yeah, and the blood disorders and many things. 371 disease and injuries is a huge number, including the infectious diseases, including the injuries and communicable diseases, non-communicable diseases.
Mm-hmm. All right, so we have another questions, Prof, from YK Chan. What proportion of our doctors know about these tools? Are the current medical students being exposed to this in their undergraduate days? There's two questions YK Chan has asked. What proportion of our doctors know about this tool? The second question is, are the current medical students being exposed to this in their undergraduate days?
Actually, they can. What's the question is?
First question is,
What's the proportion?
what proportion of our doctors know about this tool?
I'm not sure, but based on the based on my best knowledge, to the best of my knowledge, few people only knows about this GBD and the tool. It's free, can be accessed, can be used. Not too many people knows about this, and students can use this. But based on the quality of data, is the level of data, the level of results are high level. I mean, considering our undergraduate students. But for postgraduate students, yes. For researchers to present, yes.
All right. Any more questions from the member of audience? There's quite a number of them have mentioned that it was a very helpful presentation, great information. Thanks for sharing. So, all right. So it looks like there is no more questions from the audience. So with that, I think we will thank Prof. Hesham for his comprehensive and detailed presentation on global burden of diseases and how we can make use of the tool and how it has helped the public health sector. So thanks again, Prof. Hesham, and thank you to all the audience who have joined us today. Thank you and have a great
Thank
day.
you very much, Dr. Aaron. And there is take-home messages, a nice one written by the maybe administrator or the committee. It's a nice one here for the others to read.
Mm-hmm.
Okay, it's about what we have just discussed about. Most important is explore the GBD data sources and try to review the results and investigate how the GBD results can be used for publication or to inform the policies.
Yeah.
Okay,
Yeah.
thank you very much.
Thank you. Thank you all. Thank you.
Okay, bye.